Welcome to the Town of Babylon. On behalf of Supervisor Rich Schaefer and the entire town board, we welcome you. I'd like to introduce my colleagues in government. We have the Town of Islip Supervisor Angie Carpenter, Town of Islip Councilman Jorge Guadron, and the Town of Islip Tax Receiver Andrew Whitman, along with our councilman from the Town of Babylon, Tony Martinez, Councilman Terrence McSweeney, and our Receiver of Taxes, Jen Montiglio. It is the Town of Babylon's privilege to partner with Northwell Health and the Town of Islip to raise awareness for the fight against breast cancer with the Pink by the Bay campaign. So I would like to introduce Rob Labiento, our Director of the Town of Babylon Health and Wellness.
Hi, everybody. I'm Rob Labiento. I'm the director of the Health and Wellness Program for the Town of Babylon. I just want to thank you guys for being here. This is a great event. It really encompasses exactly what we're trying to do for our Health and Wellness Program for our town employees. It brings together our physical fitness, mental health, medical care, and nutrition, and it does a great job of this. And again, thanks so much. This embodies exactly what we're trying to do here. I appreciate it. Thank you. Thanks.
Ready? Okay. And now Angie Carpenter, Town of Islip Supervisor.
Thank you so much, Jerry, and it really is an honor and a privilege to, again, partner with the Town of Babylon. This is the 4th annual Pink by the Bay event that we're doing jointly, and I think the more we do things together, the more effective they're going to be, and it is so wonderful seeing so many of you dressed in pink here this morning to raise that awareness, and that's what it's all about. And, you know, I have all of these prepared remarks, but I wanted to say something. Caroline Smith, who heads our Public Information Office, just shared with me yesterday about Katie Couric, and I had forgotten about that. And Katie had been a little delinquent in getting her mammograms because of COVID, and so many of us put off the preventative medicine kind of things we should be doing because of COVID. But she finally did get to her mammogram and fortunately caught it in time, did have breast cancer. And I think when you have someone at that level who is willing to be public about it, to share that information is so very important, because sometimes when people are diagnosed with any kind of cancer, it's like they just want to keep it to themselves. They don't necessarily want to talk about it. And I think the more that we can talk about it, the more we encourage others to be proactive about themselves. Pay attention to your body if something doesn't feel right. So as they say, prevention is the best medicine and the best detection. Early detection is prevention. But again, I want to thank the Town of Babylon, especially my good friend Rich Schaefer, who unfortunately could not join us this morning, and Tony and everyone from the town who were such incredible partners, and my partners in the Town of Islip who took the time to be here this morning, Councilman Guadron and our tax receiver, Andy Whitman. But especially I want to thank Northwell and that incredible team led by Donna Morovic and Eddie Frazier and Angela and everyone that does so much to be there for our community on a day-to-day basis. It's not just when someone has an issue and has to be raced to the hospital or has an issue that, you know, requires hospitalization, but it's every single day that they're there for our community. So you do a great job, and we're so grateful. Thank you so much. Jerry tasked me with introducing the next speaker, and she is from Northwell's Breast Imaging Center, and that's Dr. Nina Vinkov.
Thank you so much. I'm Dr. Nina Vinkov. I'm thrilled to be here. It's great to be here supporting breast cancer awareness with the members of our community. You know, people talk about breast cancer awareness, but the truth is we're all aware of breast cancer. It affects 1 in 8 women. If it hasn't affected you, it's affected your family member, your friend, your coworker. And so really breast cancer awareness isn't so much what we need. We need to send the message to women that they can be aware of the things that they can do to reduce the risk of dying from breast cancer. And so if I had my choice, I would rename this whole month, the whole month of October, instead of Breast Cancer Awareness Month, I would be calling it Breast Cancer Screening Awareness Month. And there's There's so much to be optimistic about. Excuse me. We have better both screening and treatment, and we're personalizing both screening and treatment. By having your mammogram right now today, you reduce your risk of dying of breast cancer by 40%. And you also reduce the risk that you're going to need aggressive treatments. If you have breast cancer, you reduce the need for mastectomy, for chemotherapy. So there's so much to be optimistic about. And I know that a lot of people delayed having their mammograms during the pandemic, or people who delay having mammograms just because they're afraid. But I always try to tell my patients to think about your mammogram as a positive experience. What you're actually doing is something to empower yourself. You're taking a proactive action to prevent breast cancer from having the impact on your life that it could otherwise have. And so please think about it positive. Please have your mammograms. And thank you so much for inviting me to be part of this wonderful event.
And next is Deb Salas, Dr. Deb Salas Lopez. She is the Senior Vice President of Community and Population Health.
Thank you very much. It's an honor to be here on behalf of Northwell Health. I'm the Senior Vice President of Community and Population Health and oversee the community health and public health strategy for the system. When I see the sea of pink, as Dr. Vinkov just said, it's a reminder that we all have to not only educate ourselves, but encourage those we love, including our male colleagues and friends, to get screened for cancer, to check your breasts. Dr. Vinkov happens to be my doctor. I recently got my mammogram. She came into my room, she explained, she was great. So even as physicians, we have to take care of each other, we have to take care of our community, and we have to lead by example. And so it's great to be here. Thank you to the wonderful team that sets this up every year. Thank you to the town and all of our public officials for allowing us the presence in your community. It's a pleasure to be here, and get screened. Thank you.
I'd like to introduce Jennifer Farrell. She is a breast cancer survivor. Thank you.
Hello, everybody. Thank you so much for having me. I'm very grateful to be here. When you look at me, I want you to see the poster child of what not to do. So 3 years ago, I was diagnosed with stage 3 breast cancer of the right breast that spread to my lymph nodes. In the midst of planning my daughter's first birthday, my husband looked at me and questioned me and said, "You're a female, you live on Long Island, don't you ever do breast examinations?" And I thought to myself, why would I? No family history whatsoever, never a smoker. I was a thriving young adult. I'm a registered nurse. And that night, I decided to do a little bit of an exam. I thought I felt something. I was a mother of 2 young children. I was pregnant back to back, recently weaning my daughter off of breastfeeding, so my anatomy was a little off. I thought I felt a P, this little P-shaped thing in my right breast. Didn't think much of it. 1 month later, that P-shaped thing that I felt tripled. It turned into a golf ball. Being a nurse, this is an abscess. I think many can agree, the health professionals that we have here, how fast it grew. It's an abscess. I'll get it taken care of. I went for my breast ultrasound. When I saw the tech turn her screen, I knew I was in trouble. Fast forward, my journey was a total of 3 years, 1.5 years of chemotherapy, 25 radiation sessions, a double mastectomy, lymph node dissection, breast reconstructive surgery. I'm here standing in front of you to show the positive experience that I had. Although some of you may think that was a horrible experience, I am what trial and error has perfected. I am able to stand and share my story with so many young women and men of all ages to know that cancer does not discriminate, and do not be naive. If you feel something, say something, right? Like they have the Subway advertisements and everything like that. When people ask me what kind of breast cancer patient I was a quiet one. I didn't really tell many people. I did not want to be treated like a breast cancer patient. I got my children up every day for school. I made my husband dinner 5 days a week. I just didn't want the stigma that came with it. I was very wary of the color pink, and I was quiet, and that's just how I dealt with it. So if you know somebody who is going through breast cancer, whether if it's stage 1, stage 4, if they're fine, if they don't feel fine, always offer the support. Because even though they're not asking for it, there's a piece of them that could definitely use it, okay? These organizations, I'm so grateful to work for such an amazing, supportive healthcare system like Northwell that offers these breast cancer, survivor months and the mammograms. Use it to the full potential that they give to you, because some people do not get this opportunity. Again, early detection is key. What you can also take away from my story is that, and I do think about this a lot, if I would have acted on that small pea shape, my life would have been completely different. I'm so grateful for the medicine, but again, take that away. Early detection is key. Early prevention is key. Listen to your body. Thank you.
All right, so once again, everybody in this room, you heard early detection is key. Get checked. If you have any questions, if you need any help scheduling your mammogram, there's a team right up here that is willing to help you do that. And I want to thank everybody for coming.